Good morning, everybody. Good morning from Brazil. My name is Mayara Floss. I'm a medical student from Brazil, and we are starting our 11 Rural Family Medicine Café. I'm very, very happy to be here. And today we have some special guests participating, and it will be about arts and rural health. So I hope we could enjoy it, and I will ask to everybody introduce yourselves. So could Amanda go first?
Sure. Well, thank you very much. It's lovely to be here, even though it's a Sunday and a sunny day outside. As you may know, the president-elect for Wonka, and I'm a family doctor in the UK, in fact, in the far east of England, quite near the sea, where you then go across to the Netherlands and Amsterdam. So it's a rural area by English standards, although I live in the city because I also work in the university here. And as I said recently in my poem, I helped to run a medical school where the students go to family doctors all over our region, maybe 40, 50K from the nearest hospital. It's the most that the patients would live in this part. But they have sites, so a lot of my colleagues are working in small communities, rural communities, and a big coastal area, which is very poor and has very bad unemployment. In the old days, you know, it was very busy, but now this area doesn't have such a good situation. So that's my contact with rural, and we can discuss the art issue in a little bit.
Okay, thank you. Amber, could you go?
Yeah, sure. My name is Amber Wheatley. I'm currently a third-year medical student at Swansea University in the UK. I'm originally from the British Virgin Islands. This is where my interest in rural medicine started because we have quite an interesting geographical situation when it comes to healthcare. I'm also part of the Rural and Remote Health and Medical Education track at Swansea University, where I get to experience rural healthcare in that setting as well. My interest in the arts and healthcare, I am a bit of an amateur writer as well as an amateur ballet dancer, and I found that that's always helped me cope with the stress of medical school. So I'm really interesting to sort of hear other people's perspectives on the way we can use art in rural medicine as well.
Bianca? Good morning, everyone. My name is Bianca. I'm a medical student from the south of Brazil. I'm from the same state as Mayara, but a different city called Porto Alegre, which has approximately 2 million inhabitants. I am in my 4th year in medical school, and I really appreciate arts in the health. I have already used arts in mental health projects. It had amazing results, but in rural health, I don't know if it would be different, so I'm willing to learn a lot with you. Thank you. Shale?
Hi guys, my name is Shali Prasad. I am currently at the University of Minnesota, Minneapolis, in the northern part of the US. My history with rural goes back for many years. I used to work amongst forest and rural tribes in southern India, and I'm still associated with those groups, looking primarily at health systems and primary care there. And then for about 10 years, I was a rural doc in in the state of Mississippi in the southern U.S., which for U.S. standards is pretty rural. Currently, I'm primarily involved in family medicine education and public health education. I'm a faculty at the University of Minnesota in both these places. I'm also as part of my public health, I do research in public health policy as it affects rural health. So we have a center here. It's called the Rural Health Research Center, And it's a fun place for me to be in because I'm working with health economists and health services researchers and health policy people, and I'm the clinician who comes in to talk to those people and say, hey guys, this is how it is in the real world. My interest in the arts in medicine is primarily because of I don't think we have done enough. I know historically medicine has a strong connection with the arts, but over the past few decades, I feel like we have to do more. We're getting too much ethos-based, not enough pathos-based, if you will, both in our writing, in our teaching, in our interactions with patients. I fancy myself as a writer. Most of my writing is in technical writing, which is the boring, dry stuff, but also love to dabble in short stories and blogs and things like that. So when Amber and Mayara asked me to join this, I was excited too. And one other thing, I'm sorry, I know we started late, but I have another conference call at 8 o'clock my time, which is another 25 minutes from now, so I might be leaving early. I really apologize for that.
That's okay, Shali. I would like to start with a question. I also, before we go on, I have a good background on writing. I don't consider myself a writer because I think I don't feel that I am a writer yet, even if I have wrote some books. Because I think I always constructing my writing and always constructing myself, and I always feel strange the idea to be a writer. But anyway, I bring two books today for show to you. This one is with poems. It's called Brief in English, and I did about the local community here with photographs, and I can send the PDF after. And the most important one is this one. That's the I forgot the name in English. It's kind of patchwork, and I wrote with the community and with the group of students when I was 2 years ago. And this is a very important one for me because I wrote with the community. Even if some of the community do not know how to were illiterate, we worked with some workshops with them, and we collect the stories and come back and write with them to tell about the stories that we developed into the community about the popular education and empowerment. So this is a very important one for me, and I will share a bit of these stories as well as writing as an empowerment tool and as a way to sensibilize and humanize the students and try to see the people in a different perspective. And also myself and Pariush, we are coordinating the rural health stories. That I think it's a very nice project. I'm not sure if you know it, but it's becoming a very nice one, and we have more than 20 stories now, and it's not a very old project, and we have more than 20 stories around the world about the rural background. So just to share a bit of my background. So to start, what do you think that arts could influence in the rural health and in the rural practice and into the students? What do you think that it could influence? Anyone?
So can I start?
Yep.
First of all, the word for your book is the quilt in English. It means like you put the different patches together and it makes a big picture. So great, fantastic. I look forward to seeing more. I was wanting to say three things. I think that arts and health, in fact, four things, as Amber said, I think, or Bianca said, art can be healing. So it doesn't, that's not specific to rural. but it can be therapeutic. And for ourselves as doctors, one of the reasons we write maybe poetry, maybe short story, maybe even a journal article is to try to express our experience. And of course, as Prasad said, Shali said, you write differently for different reasons. So when I write a poem, it's not academic at all. It's just me. But sometimes if I go to a poetry class, I have to be more precise or analytic or critical. Anyway, so we use it for expression and for our own health and well-being, or as for the patient, we use it this way. I think we use it to show what we do. So there was a fantastic set of photographs of rural doctors showing in my college, which is in the middle of London, and it made very visible, you know, the distances and the patients and the travel and the seasons. So I think art can be a really important way of showing what happens in rural situations and the different challenges. And then I think the third thing is then for learning and for teaching. So when students can expand their experience by reading a story or seeing another community or sharing a picture. So I think they're the sort of 3 or 4 functions of arts. And then the rural context is where we need to think, is there anything kind of special about that we can offer, like you've done, Mayara, bringing the stories of the people into a book, which sounds great.
Sure, I think it's like a great impact when we brought the book into the community, and I think this power of not just the healing, but I think art have this power, the power of caring also. When we talk to the community, they are so incredibly happy, and we have some old people into the community that they said for us, now we can die because we have wrote a book. Imagine like the impact of that, like.
Amazing.
So I think that is one of my great experiences in my life to could be able to work together with the community. But we have thousands of experiences, and maybe someone could share another one. And even like writing for debriefing, I do this every day almost. Like if I have something that's not really nice in my head, I will go and write it, and it's good for my mind. I don't know. Maybe Shale would like
Yeah,
to. Yeah.
a couple of things, and this is a continuation of the themes that Amanda mentioned just now. I just sent in a link to a book that was actually compiled by one of my colleagues here. It's called The Country Doctor Revisited. And it's been fascinating for me to see that. I had a small piece in that, but the depth of the stories, the variety of expressions from short stories to real life things, and many of them quite serious, some of them funny, a good part of it as a mechanism to protect yourself. So one particular area that I'm really interested, we pushed the idea amongst our family medicine colleagues of us being lifelong learners. And this concept of lifelong learning is very important for me because I don't think we are in any way finished products. We're always looking for the next way of improving ourselves. And the challenge sometimes as a rural doc is that you don't have the same learning community, if you will, that somebody who's in an urban area can. And so methods and mechanisms of expression becomes very important. And that's where I feel there's a huge role that arts can play. Like Meyer, like you mentioned, some of it could be a self-reflective piece on the experiences that we've had, a way to journal our day-to-day experiences, the angst that we feel when there is trauma involved in patient care, or the joy that we feel in the connections with people, and how do we link those, and how do we learn going forward. And the one of the hot button items within medicine these days is the whole concept of burnout. I'm sure it's the same in Brazil or the UK or other parts of the world. In the US, it's been one of the big parts that we're talking about. Here we are trying to train a highly sophisticated professional, say, for example, a medical person, and in a few years they burn out. So what is the point? And the best counter to a burnout, I feel, is finding joy in the work, joy in the workplace, joy amongst your work colleagues and the people that you interact with. And I'm a big believer that that happens through artistic expressions, through finding the sense of community, finding expressions in that sense of community. So I do feel that art has a very, very strong and important role to play in all of this.
Bianca, Amber? Okay, I can
I don't mind.
comment. Sorry.
Do you want to go first, Bianca?
It's okay. I just would like to add to our conversation that Smruti is with us on Facebook event, and she's saying that art is an excellent way to promote health, and that we can use scenarios created with help of idols, sculptures. It's nice to have this mutual conversation with Facebook when people cannot be alive with us here, and I think it's interesting to think that about the scenarios. One of the kind of arts that I really enjoy is the theater, and to represent scenes. I had a class some days ago where a professor was pretending to be a patient, and the students had to be the physician, and we had to learn how to get the best speaking skills and the best way to understand what the patient was saying, and this is a kind of art as well. And I believe that you have to have imagination and to be creative to invent the scenario and to use it as a tool to the learning. I believe this is a really nice thing to think about. Amber?
So the two things I want to talk about, and it's partly coming from what Bianca just mentioned, the way that my university teaches us how to interact with patients is through artificial scenarios. And I've always found that those scenarios I benefited the best from were the ones where my classmates were really, giving their acting skills all that they had. And one moment that sticks out in my memory was when we were learning how to break bad news. For example, patients who have been on life support for a very long time, telling the family, it's in the patient's best interest that we stop life support, and oh, by the way, would you consider organ donation? And one of my classmates has the amazing ability to cry on demand. And it was just like, I wasn't expecting it. Obviously, she had planned it, but I wasn't expecting it. So I was like, okay, let me just take a step back and assess, how am I feeling right now? How do I think she's feeling? And then was able to move from there. And one of the most important skills I learned from that wasn't so much the communication, but actually being able to identify that people react differently to different situations, and it doesn't necessarily mean the same thing that I think it would mean for me. So although she was pretending to cry, or in that scenario, in that moment, she was crying, it wasn't sort of a crying out of sadness, it was sort of a crying out of frustration and feeling out of control. And that's one thing that stuck with me from that. The other thing that I think art is really important in is showing that the human body isn't just flesh and bone. So as I mentioned, I'm an amateur ballet dancer. I started at 16 in an adult class, and the first class I was in, there was a lady who had both hips replaced. And the only thing that it stopped her from doing was jumping. she could do everything else, including stretching on the bar. And I thought, isn't that just amazing? She's in her 60s, 70s, she's had both hips replaced, but she enjoys dancing, she enjoys music, and she's attempting one of the hardest forms of dance, which is ballet. And I've always used that as sort of an inspiration to other patients who've had a single hip replaced or broken an arm, that just because you've had this fracture now, it doesn't mean that you won't be able to do things you never thought you would have done before you fell. And I found that out, that's always quite motivating for people, especially when they find out she's a ballet dancer. So it's not just that she's a lady who replaced both hips and is still walking around doing her shopping. It's like she was able to do something she'd always wanted to do from a very young age and was unable to do, and found the motivation through art to express that in herself.
Good. I think we are entering into where we have intersections on our university, but a lot of times we have not these intersections, and I would like that we have more. Like I discovered just this year the narrative-based medicine, where you tell the story more than the where you have all the feelings and the things that go together and what you think, and you have when patients there and the characteristics, and not that clinical just because I think a lot of times we forgot that we are kind of anthropologists when we are writing a patient story, because we have their name, their age, we have what's happening. So a lot of times we ignore our paper as telling histories, even if it's very clinical and it's very closed on that. So I think we need to explore more this part of the clinical interview, and I think arts help on it. And just to comment, John sent to me a few months ago The Fortunate Man, and it was really nice to read that book. And I remember a lot of my experience in Ireland, and it was lovely. And I just feel more comfortable, like with what the author wrote. Like, okay, sometimes it is isolated, and how the people, how the doctor deal with that, and how he deal with the contact with the whole community. It was a very interesting one. I recommend it as well. Amanda?
So I have two questions about medical education in this relation, in this situation. When we started our new medical school, which is now not so new, 15 years, we had one component where the students had to do one module in the arts. So as well as we use actors for teaching consultation skills, and we use kind of live scenarios for teaching cases, not just like disease group, but we try to make it very person-centered. But also we encourage the students to take one module in a subject that wasn't medicine. And this became less popular. People said, oh, but we should be doing something else. And so it didn't last. It lasted maybe 4 to 5 years, and then students started to say, no, we're so busy, we don't want to do extra things that aren't in medicine. And the same with students who choose to, or doctors also, who choose to write or have a hobby or something. Sometimes it is for our own health, but it's seen as not really medicine. So I'm wondering how much this group feels that, arts and health is a really central subject in the curriculum, because to me it's more like, I have to argue with my dean if we ever want to use an arts resource to make the course. And it's the same, I'm afraid, it's like family medicine. People say, oh yeah, that's great, it's about people, but, the real specialists are doing the technical stuff. So I think some of the prejudice against arts in health or some of the marginalization is the same as happens to our discipline in general. And I'm just interested in whether this group see it as like that.
Amber, can I go real quick because I have to go to my other call if that's okay.
Sure.
Yes, by all means.
So, Amanda, you bring up a very important point. We've struggled with that here in medical education too, and this is in the context of the burgeoning prevalence of electronic medical records. My observation is that electronic medical records is taking the soul away from the narrative because we are expected to be very reductionistic in our documentation. It's all these fancy smart phrases and quick hits and things like that which are dry. There is no narrative power in any of this, and that's the challenge that I'm seeing in the new generation of medical education, is that we have gotten more reductionistic. So we have had some attempts at exactly what you've been talking about, and it's been a double-edged sword, as in we've had a bunch of medical students who look at this as, oh my God, do I have to do this? So they're really not participating in the same extent as we would like them to. And so that brings up the question: Do we open it to everybody, or do we deliberately keep it to the ones who want it? And on the flip side, how do we emphasize, if we don't get the support from the higher ups in medical education, the deans of the various schools, how do we emphasize the importance of this? And I think that's where our challenge is. We need to, from a structural viewpoint, emphasize the importance of this. And then functionally, we need to try and see, coming up with the best curricula to do this. And with that, I'm really sorry, folks. I have to jump to my other call. It's been wonderful meeting you all. I hope to meet you folks live one of these days, but at least connect through this channel till that time. I'm sorry. Bye. and keep up the good work.
It's
Bye.
okay.
Thank you.
Thank you for participating. Amber. After Amber, Jess can say hi. Jess. Okay.
Okay. Yeah. So what I wanted to talk about was what Amanda was saying about doing one module that's not directly medical, because I really like that idea. Like, my university has kind of tried to do it. We have one module called Medicine, Health, and Society, where they try to introduce more sociological aspects of medicine as opposed to just the purely scientific. And we also have some modules in psychology, for example, in stress management, etc. And some of my class love it and some of them hate it. So I'm on a graduate entry course, and not all of us have a background in science. And because of that, we get very mixed reactions to things. But what I've noticed is when we're talking with some of the doctors that teach us, they're more interested in the medical students who haven't done a degree in a scientific subject before. So, for example, people who've done classics or done languages, they're more interested in what they've done and how they've got into medicine than people like me who did biomedical science or biochemistry, because ours is very much the orthodox route. And the other thing I wanted to mention was that in my interest in, for example, in dancing, a lot of my classmates have often commented, oh my God, I don't know how you find the time to do that. We're so busy. But I think it's about working smart, not necessarily working hard. So I make time for my ballet. Like, yes, I'm very busy, but everything is scheduled in. I make sure that I have that afternoon off that I can recover, because ballet is very intense. And I find I work better that way when I've scheduled in that amount of time where I can, first of all, not think about medicine, but also just kind of be more aware of how my body is moving in space, if that makes any sense. And having that freedom to listen to music and build a relationship through that artistic expression. And I think it's one of those things where the teacher has the wisdom and the student is kind of not really getting the big picture. we don't really see the value of having time when we're not doing something that's purely scientific, purely textbook. And I think that scares a lot of people when we're sort of expected to find something within yourself that isn't regimented. But I think that's what makes you a doctor. It's having that sort of into the unknown feeling and being able to navigate it very well. So I'm hoping that they bring back that idea because I'd love if my university did it as well.
Good. I will just ask for Jess to introduce yourself. Hi, Jess. We are running the conversation, but feel very welcome.
Okay, can everyone hear me?
Yeah.
Okay, good. I'm Jesse. I am from the United States. I'm in an osteopathic medical school in the state of South Carolina. And so I heard about all this through the National Rural Health Association through some of our Wonka representatives. So I came in kind of late on the call. Are we talking about, do we have a prompt? What all are we discussing right now?
Jess, we are discussing about the influence of art and the influence of arts on rural health and rural medicine. And what is our how this influence in our day by day and these kind of things. So if you have any input that you'd like to bring.
I know Amber was talking about kind of in medical education having the split of you have some traditional science type students and then like these non-traditional. And my original education was in psychology, but even before that I was very heavy in music, and osteopathic medical school admissions have made a move in the past several years to, it's part of our philosophy as practicing medicine that you examine of a patient the mind, the body, and the spirit in one. And so they have made a move of admitting non-traditional science students. And one of my friends in school has a degree and background in visual arts, and I began to see how visualizing anatomy and things like that put her ahead versus other science students. And with my background, and my background is in it's American gospel improvisation piano, which is based around patterns. And so I began to realize that I had a knack for seeing, especially in a primary care sense, patterns in not just numbers but in behaviors and in looking at through being able to use EMR to like I recognize patterns. So I hope as a whole admitting students that are more than just that traditional science will begin to grow an eclectic ability in our medical community across the world that we don't need to be, I don't feel like we need to be as rigid in our selection of who becomes physicians just because they had science backgrounds. So that's kind of where I stand on that.
Good. Anyone would like to comment?
Yeah, I'm not sure if Amber is waiting to comment before me, but we also in my school have, in fact across the UK, have seen some effort to make a broader scope of subjects. So the students still have to have very good grades, but you know, you don't have to have chemistry and physics. You could have biology and history and, you know, chemistry at a lower level. So I think that shift is coming. And also, as Amber said, for the graduate track, there's some adjustment. And I think the rural and remote schools in Australia, which I know best, also have a different set of entry criteria. They look a little bit more at the person and their personal attributes and their general academic potential rather than having very strict science background. So I think we are seeing that shift across the world. And I think it's actually a really good shift for family medicine, because I suspect that there is some link between that broader perspective and people who then remain interested in the broader.
Amanda, it cut it?
Now finished.
No, not finished. You're saying about the interest.
Sorry, take me again. I missed a little bit there, it broke up.
No, yes, you're talking the last one, the last part, like. No, it's
Yeah, okay.
yeah. No,
Sorry.
it's okay.
Yeah, so only that the students with a broader background may keep some broader interest, but then we also need to keep everybody, with this perspective, a broader perspective, a person-centered perspective, a perspective to look after themselves. In a sense, I think Amber said the teachers were more interested in the people with a different background, and I kind of think, well, I want to change the view of the ones who come from a more conventional background, and open their minds and help them to be more interested in, I don't know, the breadth of human factors. But I'm also asking Mayara, perhaps in particular, what is special about rural? So we're talking quite a lot about arts and medical education, but what is special about rural for this discussion?
Yes, it's a very good question. I think the importance about rural is, first, my personal feeling is that we need to discuss it more, because we have few books about it. Like, when I would like to find some way to support what I'm experiencing, I have few, and I think the rural health stories came from this idea, like of bringing more this arts viewing and making it more accessible, and having the idea of telling stories, or by video, by poems, by stories, short stories, any kind of stories. And I think this is one of the great things, like that. I have the feeling that India have so many good ways of telling stories, and I have Nepal one, and then I have Brazilian one, and I have UK, and I have this. I think people have this way of telling stories that are so different, but they are sharing their experiences, and I think we arts in rural, it's a way to share experiences, and not the formal one maybe, but I think it has a much better impact on my learning than much of the clinical stuff that I'm studying, So this is my personal opinion, but I think we should use art to put people together closer, like to discuss together, to make it we feel like the cult, we are like the cult here, and then we can share by arts, we can be together as a quilt, and I think art is a way to do it. It's my personal opinion. I don't know if in rural background, I think arts is the way that we can get together, connect together, and even like you don't need to be connected on the internet to feel connected with the Fortunate Man book. You know, you don't need to be really connected to be connected with a song, with a poem. So I think arts can exceed and you feel connected with other people. It's just my point. I don't know if anyone would like to comment.
I'd like to comment.
Oh, sorry.
Go ahead, Bianca.
Okay, thank you. I was I have some 3 points to comment actually. The first one was about what Amanda said before about medical education. I just would like to add one thing, that I think that it would be similar with what Amber said, but I would be the other person. What I mean is that, especially here in Brazil, we have a really, really heavy medical faculty in terms of hours of a day. Sometimes we have 10, 12 hours per day of practicing classes and theoretical classes. So I understand when students say, okay, we have a so busy schedule, and adding one more discipline about arts maybe could be too heavy for us. I understand when students say that. I'm not saying that I totally agree, but in parts, yes, because I think that we have so many things to learn about everything that sometimes we just want to have a break. But at the other hand, I totally agree that arts is so important, and also it can be a way to run away from the conservative uh, way of learning and teaching. And this brings my second comment about teachers and professors. I have to say that this class that I just mentioned before about having this scenario and the professor pretending to be a patient, it was a professor, a woman, really young and open-minded. I believe that this is really important as well, because our conservative professors, usually the oldest ones, they are not open-minded, and they totally think that we should not learn about arts or anything else. I am, of course, talking about my faculty in particular. I don't know how it is in yours, but I see that the professors that are more conservative, they are not open-minded, and they think that we should only learn about diseases and this stuff, and they think that the open-minded professors that are trying to help us with our speaking skills and stuff like that, they think that we are wasting time, and usually they are the same ones that believe that the specialties are the real medicine, and general medicine would be nothing, and all about this prejudice. So I think it's important and it's interesting to think about it. And I hope that this open mind, these youngest teachers, they come more and more, and they can help us to change the medical education. And I hope that, especially here in Brazil, we can decrease the hours of classes a day, because I have studied in England, and we had much less hours of classes in our university, and it was much better because I could stay at home and choose what I was going to study and manage my study, and it was really better. And the third comment I would like to say is that as well as arts can help rural health in a point that can link can link physicians in a way that I believe that arts can decrease the isolation of physicians, maybe bringing some arts from outside, but also I believe that we can use more arts in rural health, helping the patients as well, because maybe talking about arts in rural health and bringing some different concepts, we can increase participation of the public, of the communities, and we can stimulate them in producing things, and even maybe asking them to publish other place, otherwhere. So I don't know if I could express myself. I think that art is a really difficult thing to talk about, but I hope I did.
Amber?
I wanted to comment on Amanda's question about what is so special about rural health in particular. Being from the Caribbean and contrasting that with my training in Wales, it's a very acute difference in the way that people communicate, especially in my little hometown, because everybody knows, my parents, my grandparents, my great grandparents. So one thing I've found is that I've had to adapt the way that I explain things and talk to patients, not necessarily to get them to understand, but in a way that's more receptive for them. So, for example, I use humor a lot in my explanations, and the humor that I use here is very different from what I would use in Wales. Um, and I think that is part of the art of medicine. It's, using comparisons to get patients to understand what a procedure is like, using humor to get people to relax. The way that I would talk to my grandmother is very different from how I talk to a baby, well, not a baby, a young child when I'm in a clinical setting, and it will be different whichever Caribbean island that I'm on, or whatever country that I'm working in. So I think that's the thing that's different about rural medicine compared to just working in a hospital or in a town. The way that you communicate is much more personal, and it has to be a bit more creative than if you were in the city. I hope that answers it.
Thank you, Amber. Just to clarify, I was meaning, the issue for rural and arts. I understand what you've just said about changing how we communicate or different metaphors. And I understand quite a lot about the difference between rural and urban communities. Although, I'm sure also there are many different types of patient. We have to do this in all the settings. But I was specifically interested in whether it was different, there were different issues for the use of the arts in rural health. So that was more my reflection. But you've commented, and what Bianca said about using arts to communicate or network, and Mayara, I think it may be as different. In another way, I work in an urban setting, and I would say I have to change my communication for many different patients from different backgrounds there too, different ethnicities, different ages, different educational backgrounds. And I think the opportunities for engaging with the community through the arts may be quite similar in urban and in rural settings, that it's a way of giving people voice or a perspective on their own lives. So again, I'm just thinking, so what's the special, rural angle? Maybe it's partly that rural is less visible. So when I saw those beautiful pictures in our college, I thought, I don't often see pictures of rural doctors, not real rural doctors. Whereas, a lot of the images that are shown in the medical school will be consultant in the hospital or somebody in the lab, or, it won't be a family doctor going out to visit a patient at the seaside. So maybe that's one of the differences.
Can I comment? Yeah, I have 3 things to comment, so I think I will be just to point some of the things. With what you just said now, Amanda, I have the same feeling than you about the pictures and about the images. And we have I tried to do the hashtag rural woman GP, because I feel that I don't have pictures of GPs, women in the rural area, and I feel disappointed. And I didn't have a lot of people joining it, but at least I have few of women in real rural places, and I feel more happy with that. I think also we can go ahead, not just in our education, but in the communication of the patient, and with the community as well. If you think in a community just working with the community, the book was a way to bring people together, make them think together, talk together, and I think arts have this power. Also, I will bring an example. It's not my experience, but when I was organizing the indigenous seminar, state seminar that I did here,
a doctor were talking about an experience that she's an indigenous doctor, and she was trying to explain about the human body in the indigenous tribe, and then they modeled in the clay the that's something from the community. And doing the clay, they did the uterus of the woman, and then they did together how to explain how it works, the pregnancy, how it works, the whole body, woman body, using clay. Clay. I'm not sure if I'm pronouncing it correctly, but they did it, and it was ours. If you go and see it, it is ours. And we invented to uh, bring contests of anatomy in the project, the Health Education League. What is this book about it? We did a workshop with the community that is for them to draw before we give some white paper for them with just the human body, but not with anything inside, just round. And then we said, now you can draw your heart. And then after we give another white sheet, and now you can draw your lungs. And now you can draw your liver. And that's go for all the parts. And then they draw it, and we could see that we have a totally different perspective, my perspective. And we don't blame on them. This is the best part. We just say, look, we have a different perspective, and then we bring an anatomic man, like to take the parts, model. I'm not sure if it's the mannequin, and then we saw, look, this is the way that medicine saw it, and it was just amazing. They love it. And then we say, we just look at how they perceive their body. Like I remember that we asked for a woman to draw a brain, and she draw it outside of her head, not inside, outside. And this was like, oh my God, like how she experienced and understand it. And then when we asked it to draw the lungs, they draw the lungs like from here until half of the belly. I don't know, more like a very big thing. So how breathing has an important role, and so we find a way to communicate and to bring together our different points of view with arts. So I think arts also can have this powerful way of communicate with patients, and I think it's much more intense on rural, where we need to use more, where a lot of times we have different backgrounds, and we need to use this cultural competence. I think part of this cultural competence is arts. Sorry for the long talk. I don't know if anyone would like to comment. Maybe Jess, that you're a little... Yeah, maybe Jess or Amanda would like to talk before.
I can talk. The recent push to address physician burnout, especially in rural areas, I think that the use of this idea of using arts to connect rural physicians to prevent burnout, because it takes a special individual to practice in rural areas, oftentimes with great autonomy, that burnout happens very fast. And I believe the idea of connecting rural physicians through arts is something I would love to see more explored. And using arts to, you kind of touched on using the arts to almost treat or monitor patients. And I know that I was monitoring a woman with dementia recently, and she would only be able to see her neurology specialist maybe once a year because of the distance in Appalachian America. And so I had asked her family physician how does he monitor her also when he wouldn't see her that often because of where she lived, and he had devised a plan using film. So I know it's not necessarily maybe indigenous type art, but using film for her family to assess her decline. How well she could not only remember but engage with whatever film they would be able to show her. And in that same setting, there was another woman that had Parkinson's disease, and she had spent her life teaching piano, and her family wanted her to stop teaching. They felt like rest would be better for her condition, and she felt like she was better to monitor her disease by continuing her musical abilities. That it helped her keep track. She felt like she was more in control of monitoring uh, the progression of her disorder. And I like the idea of being able to use arts as healing, to give our patients a sense of understanding and power over diseases that are far more complex than they have education to understand. So.
Good. I believe on it as well. I will just do a very quick comment. I think as one of the things that need to bring here, and that we need to think for future and how to do more arts and how to bring it for the education. That it's one of the ways to bring it more to our practice and make it more close to different realities and into rural, is bringing it into the clinical modules. We need to try to think not arts in an optional module. I think arts need to be not even a model, need to be day by day, need to be much more provoke the students to write about what their experience, or to write songs, or to play music, or but this is in a day by day, not just an optional module, just to I'm not sure if anyone would like to comment. Maybe Amanda?
Yes, I suppose I should. I mean, so in my school, we have lectures, we have seminars, we have small group teaching. So the students work in group of 10, and they have cases to discuss each week. And we design the cases to make the points for the learning. It's called problem-based learning. Probably people will have heard of it. And I know that in some lectures, some lecturers might show a film clip or a picture or something like, we know in dementia people often remember songs when they've forgotten a lot of things, but they can remember a song or a dance. And I know one of my colleagues uses a clip of a film to give a positive sense of how you can help people with dementia. In teaching domestic violence, we have a very good film clip, which is a story of a woman, but it's made to make the point about how afraid she is and how difficult it is for her to stop the man. So I think that's a good way. The idea of asking people to bring their own material, I think either you would have to have a very structured opportunity for that to feel okay for people, or people might just do it spontaneously. But as a teacher, I would feel a little bit uncomfortable to say to people, oh, please bring your stories and your poems to my class when we're actually doing heart disease or whatever. So I think, we can think about this, but I think how you bring it into the core module will also, it has to be an effective educational tool. Otherwise, the students, again, will say, oh, waste of time, or that was good fun, but we need to do the real. So I think we need to be quite skillful in how we do this. And there are examples in medical schools. I think if looking, how this can be done well. And then the other option, as Charlie said, is when people choose to do it. And of course, in family medicine residency, you are postgraduates, you have more control over your learning. So perhaps when you're having your group sessions, then you could decide in that setting, do we want to do something like this? Do we want to bring some photos or some stories to help us to understand the patient or the doctor perspective? So it's a good thought. And soon I'm going to have to go, colleagues. So I will be quiet now and let you speak.
Okay, we are almost going to the end also. Amber?
What I wanted to talk about was an example of how my university has sort of incorporated storytelling into our curriculum. So the way that our learning is done is through it's a case-based system. So on Monday you will have a case presented, and then throughout the rest of the week you learn the anatomy associated with that system that's involved, the psychology, the pharmacology, etc. And one of the most effective ways I found is when they've had the patient themselves tell you about their illness. So sometimes it's a story, sometimes it's a simple chronological account of what happened, but sometimes it's through a letter or feeling concerned, because obviously some of them don't really know what's going on, they don't understand it. If from a medical sense, they only understand, this is my life and it's changing. And what I found is the cases that have been presented with a patient's story have always stuck with me a lot better. So I remember we were learning rheumatology, which is not my favorite subject. But if there was a young lady who was explaining what happened and how she felt and how it was affecting her life, and that's always stuck with me. So every time I see a patient who's presenting with joint pain in GP, I always wonder, okay, are they just sore, or are they going to, in the next 2 years, develop a chronic illness? The other thing I wanted to talk about is my university has a method of group reflection. So after every block of placement that we have, we all come together in groups of about 10 and get to discuss it with the group. And one experience that I found the most enlightening, I guess, was I was in a rural setting in one of the mountains in Wales, the Brecon Beacons, and I was in a pediatric setting. And it was quite strange for me because I was getting stared at a lot because it was quite obvious that I wasn't from that area. And one experience I wasn't expecting was that some of the children had never seen a colored person before, and I had some interesting reactions. And when I shared that with my class, all of them were like, "Oh my God, I did not know that happened." So I was, I was trying to explain to them that, it was interesting for me, but it was also interesting in terms of my medical education, because of course I had to learn how to examine a child who was inherently afraid of me, not because I did anything wrong, but just because I looked different. So I think storytelling in that sense can help both us as medical professionals and developing medical professionals reflect on the things that have happened to us and learn from them, and also to sort of enrich the experiences of other people, because we only can experience the world from our point of view. So it's nice to hear from other people what their view of the world is and use that to sort of build up our own lives.
Perfect, Amber.
Very good.
Amanda? Yeah.
Just really liked that as another image of what we're trying to uncover. Thank you, Amber.
I think also I would like to bring here before we go to close the role of internet and the role of sharing these histories now. Also, I know in more World One we have the rural health stories, but also now the family doctors in Brazil are doing the blog Causos Clínicos. That is something like translation like clinical cases, but in a different way, that people talking day by day, not like they with more art perspective and with clinical perspective, mixing both of them. And I was wrote at Balsa 10, that's something since 2013, and we just share pictures and things together. I can bring the links after, but this helped me a lot of. And I think these provocations that we are having, like in the Wonka conference, with photographs, they are doing a challenge to bring photographs and short stories and poem on the program. I think this helps as well provoke to think in an art way. So I'm not sure if everybody is connected at Wonka 2016, but they are doing like they are asking for us to bring these different perspectives of our practice, music, and I think this helps us to understand the different ways of seeing medicine. They have one exhibition and one context running now, and you can send your pictures. And I think this starts also to bring more this art perspective to our practice. I would like to ask to any one of us to the final, like to close and bring any last talk. So any last thing that you'd like to bring, and we need to close it now, and it's been just awesome. So I'm not sure if anyone would like to start. Maybe Amanda.
Well, I'm sort of happy, really. I'm glad I joined. Thank you, Mayara, for encouraging me to do so. And I will go away and think some more. I mean, I could go on talking because, you know, I have met everything everybody said. I've had a few more ideas, but I think also, you know, we should end and perhaps take the work onwards in another setting. So thank you very much, and very nice to meet you all.
Amber?
Yeah, it's been a very interesting talk. I mean, I think all the cafes are interesting, but I think this area in particular has been quite interesting, and I'm glad that we didn't limit the topic to just one particular art, such as, you know, writing or whatever, but expanded it to include all different types of performing arts. And I think we've had a very engaging panel. It's been very good, and I've learned a lot from it. So thank you very much for letting me be a part of this.
Bianca?
Yes, I'm really happy that I have joined as well. I have to say that it's an honor for me to be in the same call as Amanda, our president-elected. Thank you so much for joining us. I feel really important, and it's amazing. It was really nice to have your comments. I just love it. The experience that Jess talked with us about monitoring a patient with art. I have never thought about this before, and this was really amazing. So thank you so much for joining us. It was an honor for me. Thank you.
Jess?
I've really enjoyed this. I've enjoyed the multiple perspectives that were present. I'm on the NRHA here in the States student board, so we have a meeting in a couple weeks, and I'm going to be reporting back about this, and I have nothing but wonderful things to say. Some of our Wonka representatives have really encouraged us to get involved with this student group, and I hope that next time I can bring more of us to the table. So I really enjoyed kind of having this alternate look of having, you know, arts in medicine, which is, especially here in the States, it can easily be forgotten. So I really appreciate it.
Good. So thank you everybody that was watching us, and I know that a lot of people will go after into the YouTube. And thank you for everybody. Special thanks for Amanda that came in a sunny Sunday to talk with us. I'm very, very glad for the presence of you all. And I'm sorry about the delay, and hope to see you next time. And please, the discussion do not end now. We have Twitter, we have Facebook going on, so we can keep going. Bye.